and welcome to Soul TV. My name is Monique, and today we're going to do a short therapeutic sequence for lower back and upper back pain. Unfortunately, about 80% of Americans will experience back pain at some point in their lives, and it's really no surprise considering we spend most of our days seated behind the wheels of cars or at our desks. And unfortunately, I have this problem too. We don't tend to sit with our best posture. We tend to sit slouched over, so just a little display of that. If we sat like this all day, there'd probably be no problem. However, we tend to round our upper spine, which juts our neck forward and causes compression in our neck. And we don't keep our lower back straight up against a chair. We tend to round our lower back. So this is our posture, driving or typing or talking on the phone or texting, and we put all this pressure here at our lower back. So this sequence was designed by a teacher of mine named Brian Dorfman. He's a movement therapist and body worker in conjunction with his teacher, Desika Chart in India. This sequence is designed to create flexibility, strength, and mobility in the back, which should alleviate most of your pain. So let's begin. Since we're going to be focusing mostly on our breath, we'll start breathing. So come down onto your mat, and if it's comfortable for you, lie flat. If that is uncomfortable for you, please bend your knees, or feel free to stay in your chair. Place one hand on your belly and one hand on your rib cage. Don't let your elbows float up off the floor. Keep them down. Close your eyes and begin to breathe. Notice what moves when you breathe in, and notice what moves when you breathe out. Now, there is no wrong way to breathe. As long as you're getting the oxygen in and the carbon dioxide out, you're doing a good job. But for asana practice, for yoga practice, we want to switch our breath a little bit so it supports the therapeutic nature of our movement. So we're going to try to inhale into the rib cage and exhale by moving the belly back towards the spine. The breath is in and out through the nose. Good. So you can close your eyes now if you're still watching me and feel the breath, the inhale, move into your ribs, the front, back, and sides. And then on your exhale, you're moving your belly back towards your spine and your spine towards the floor. Keeping your belly slightly in, breathe into your ribs. And continue that breath pattern a few rounds. Letting the inhales expand your ribs and the exhales move your belly back towards your spine. This frees any blockages that we have around our rib cage. They don't call it a cage for nothing. And starts to slightly encourage strength building in our core. And once you have that breath pattern down, take your arms out to your sides and bring your knees in towards your chest, and then bring your hands onto your knees. Your left hand on your left knee and your right hand on your right knee. When you exhale, move your legs in towards your belly and your belly towards your spine. And when you inhale, straighten your arms and press your legs away. Begin your exhale and begin to bend your elbows, bringing your thighs in towards your belly and your belly to your spine. And then begin your inhale and then press your legs away. So that simple motion we call apanasana in yoga, which means energy-freeing pose. So as you do this, begin to free some of your energy. Notice what thoughts are in your mind. And as you exhale, let those thoughts float away. And as you inhale, visualize breathing in white light, clearing your mind, clearing your body. Good. Do 2 more of those with nice even breath. Make sure you're not poking your chin up towards the ceiling and your neck is long. You also do not want to bring your hips up off the floor. You want to keep them down. And keeping all of that alignment and the breath, we're going to slide our hands behind our thighs now. And on your inhale motion, push your heels up towards the ceiling. As you exhale, bring your knees back into your chest. And continue that motion on your own. And you don't have to straighten your legs if they don't go straight. You can keep them bent, that's fine. And don't ever force your body. Inhaling and straightening the legs. And again, we don't want the chin rising up because that creates pressure in the neck. We're going to keep the neck long. And we're going to try not to lift the hips up off the floor. We're going to try and keep the hips down, even if that means the legs only go up a little bit. It's more important to keep the spine straight than it is to get the legs straight. And this time when you go up, you're going to stay lifted. This lengthens the back of the legs and the back and the neck. We're going to stay and breathe, holding the backs of the legs. So again, maybe you're here, and that's fine. Breathing into the ribs and exhaling from the belly. On your next exhale, release the pose, bring your knees into your chest, lengthen the back of your neck again, and place your feet onto the floor with your knees bent and rest your arms at your sides. Make sure your face is soft and your shoulders are relaxed. And now that we've lengthened the back of the body, we're going to strengthen and mobilize the hips and the spine. As you begin an inhale, begin lifting your hips up off the floor. And when you exhale, start to roll back down. But you don't want to come down in one line. You want to come down, each vertebra touching the floor. And then you lay your tailbone down on the floor last. Inhale, curl the pelvis up 1 vertebra at a time as the hips lift. You'll feel your hips strengthening. And exhale, and as you come down, you're not just coming down. You're also coming forward, so you're creating some space in the lower back. Keep the chin from poking up. We want to keep it long. And as you exhale, the belly's dropping to the spine, and the spine is dropping to the floor. Do 2 more in your own breath length.